link to our website that has our resources. And I am going to stop sharing my screen. And then we can open it up for questions.
So Dr. Golden, as of right now, we do not have any questions in the question and answer box or the chat box.
Okay. So if there are any questions, 2 participants raised their hands. So we have a thank you. Let me just look and see. Any other?
So we do see a comment from Jerry Mullins saying, would love to see this at our faculty meetings.
So what, there's a couple of things that, that can be done is we certainly can do presentations at faculty members, but we're faculty meetings. So, that is a request that can be honored. The other thing is that we can also, as I mentioned, that the video will be available on the website of the overview that I just provided. So that's a way to really be able to disseminate it, and perhaps it might make sense for us to send out an announcement late this week or early next week to have that.
We have 3 people. This is Tamla. We have 3 people who've raised their hands, so I'm going to allow them to speak.
Okay. Yeah, and if you're speaking, just take yourself off mute.
Hi.
Hello.
I'm glad you can hear my voice. Thank you very much for a great presentation, Dr. Golden.
Sure.
You offered great resources and great information. And thank you for offering, recorded webinar that can be available to the faculty as well. One thing that I still personally do not feel confident is really leading a conversation in my group. I do work with a, quite diverse group. And as you can imagine, people have different stances on the matter. Not everybody is necessarily on the same page. So, small group discussions, I definitely believe in the power of it since we all work together closely. But I personally still do not feel confident in leading the conversation because from my point of view, the conversation can go in multiple different directions. Like how to manage the conflict on this highly vulnerable and important matter.
Right. So I think right now what we really want to be facilitating are listening sessions. So really the intent now is to listen, to hear, what it is, like, for example, what are people's experiences in the work environment? Because, it's really hard to determine what are all of the steps that should be taken without fully understanding what the contributors are. So that's why we're sort of focused here on listening. Now we do, if you're having a listening session, we can have someone from, our office sit in on the session, in the event that, just to sort of, if things sort of get steered in a direction, in which, you might be uncomfortable. I think some of the keys to not becoming defensive and just listening really help to keep the conversation from going that way. But, our staff have been sitting in, on sessions if that would make you more comfortable. Now, the one thing I will say is that if you have a situation where you think a session is necessary because there has been some type of conflict already, then you should reach out to us so we can really understand what is at the root of that, because that may actually be more like a facilitated dialogue, like I was talking about earlier, which is very different than a listening session, if that makes sense.
I have one more hand raised, and then we can go to the typed questions.
Okay. Dr. Apple. I think he has to unmute.
Oh, okay. I just got it. Okay. Hi, Shrita. Thanks for leading us. So I want to ask you about the listening session. I mean, we've had actually, I think, at least 2 in epidemiology, and we've had, maybe you want to call them listening sessions. So they're brief, opening meetings where we spend 10, 15 minutes on these events. It might not be, it's more about the sort of the national events and maybe not about our own environment. But I feel that and at this point, I'm at the point where I feel like I do want to move on to solutions and discussing, for example, in the Wealth Center, well, let's focus on our local environment, our education, various dimensions, and that, I don't know, but almost feel like I do need to move on at this point. But you seem to be very, very, adamant that the listening sessions are still the appropriate sort of task at hand.
Yeah, I mean, so I totally no, and thank you for that. And that's it. And remember, different departments are going to be in different places. So there are some areas that haven't had discussions yet, and so that's why we're mentioning listening. But I think one of the things that was particularly challenging for me in our office at the beginning of this is everybody was so understandably upset and uncomfortable by what was happening, that they were like, we need to move to action right away. And, there was sort of, many of us in the Black community have felt like, okay, this has been evolving for us over 401 years. So like, we're not going to be able to solve it in 4 months. So that's why, I'm not the kind of person to say, let's listen for the next year. That doesn't make any sense, obviously. But if we continue to listen well over the next month, we had started designing, I had written a draft of the Johns Hopkins Medicine Diversity and Inclusion and Health Equity Action Plan that was almost finished right before all of this happened. So right now I feel like I want to make sure that the issues that have been incorporated into that plan based on what I'd heard over the last year, that there aren't things that haven't been missed that we could hear from these sessions. And so I think that's the key. I think that if you and your team, sort of feel like, we're ready to think about there are some like low-hanging fruit things that we can do right in our environment, then I think that's effective. I think it's just important to make sure that all the employees are ready to move to that stage. So I think there are some other questions.
Yes. Did you want me to read these out loud?
Yeah, that would be
There's
good,
both
Sharita.
Q&A and chat. So I'm going to start with the chat box first. So one question we have from Joyce Yeager is, what steps can she take to encourage her department to have a listening session?
Yes. So I think it would be important to, to mention to the departmental leader that it would be important so that, the employees in that department who have been impacted know that the leadership recognizes that this has been difficult, and to that there's a benefit to hearing, how, a given department might be able to do some really simple things to help better fortify and support that community. Because I think one of the things we want to think about, like, we can't solve all of the racism in America, but we can certainly influence what happens within our own walls so that people aren't re-traumatized when they come to work. And so, that's an important part of having a listening session. It's been very interesting. A lot of employees are speaking up for the first time. Like, they have been working here for years. And then, they say, oh, we want to have a listening session. And then we sort of find out from, HR that people reported an incident related to what happened recently, but in fact, there's like a 10-year history of things happening because people have never had the opportunity to speak up. So that would be an important reason to have it. It's very easy to think that everything in a department is okay based on one perspective. So, and feel free
Great, thanks, Dr. Golden.
Yeah, when that's available.
Yes. So several panelists or several of the participants had asked about the URL. So I did copy and paste it into the chat box. In addition, I did provide additional information on where to find the resources for racial discussions. So that is in the chat box. So we have a question from Ashish Shah, thanking you, saying it's very insightful and detailed. And the person is wondering, what sort of outreach is planned for Hopkins All Children's in Florida?
Okay, so that's a very good question. So really the same outreach that that we're doing for all of the hospitals. So I think after the 4th of July holiday, I will have an opportunity to discuss and review this and brief Tom Commence's executive leadership team at All Children's. You know, all of the hospitals, including All Children's, have a diversity council and employee resource groups. So we will be working with those groups as well. So, and Cherie can comment on this. We just finished certifying our last set of diversity awareness and unconscious bias trainers. And I believe we had, Cherie, did we have somebody from All Children's in that group?
We did, but because of changes in personnel, had to withdraw from this cohort, but would be available for the 3rd cohort, which we're planning sometime in the fall. So as Dr. Golden mentioned, so we've trained 2 cohorts of people, and we should be ready to launch them later this summer. Part of the issue is that most of us are accustomed to presenting in person. Our new normal is Zoom. So we're trying to make sure that these sessions, so listening sessions, that they're interactive, that they're following the best practices. That's what's taking us a little bit of time to get up and running. So please bear with us. We have people, but we just need to give them the tools they need to go forth.
There are some other questions I think
yes.
I'm able to see.
Yes. So let's see, I'm just scrolling through here. So one person's in the ICU. This was Sean Sullivan, and I wanted to acknowledge those of you who said thank you as well in the chat box. So thank you. We appreciate the feedback. But Sean Sullivan asked, I want to have a discussion at the change of shift huddle, but I don't want to bring up a heavy topic without having the time to have a discussion. Getting staff together is difficult in the ICU setting. Any recommendations?
Yeah, so no, that's a very, you know, a very good question. You know, it may be that in the ICU is a challenging setting, and so if there was any time, I'm just trying to think about the change of shift huddle. If there's any way, like maybe to extend one of those sort of shift changes by about 15 or 20 minutes, just to allow a brief dialogue. I am thinking back to very old days, so this may not be how it works now, but I remember when I was a resident that we would often sort of set aside like 30 minutes after that change of shift, or to go over education and teaching. So if there's some way to incorporate it that way, or to have a retreat with the staff where, and now it's very easy to do this by Zoom, you know, where there's like a sort of a staff discussion time specifically set aside for this, might be another way to do that. And I think I saw a related question about panel size. You know, I think it depends. You know, I know in marketing and communications that Suzanne Sawyer did this with her all staff team of 180 people, and it went really well, but she has subsequently broken that down into smaller discussions with each of the divisions in her department. You know, I think for very small, areas, I think it depends. I think probably having groups of more than 50 might be challenging. You know, so if you have a very like large department, like mine is medicine, there's like over 600 faculty, you know, the sessions might be better done by division, for example.
And also, Dr. Golden, I would add, if you're going to have a large group, you might want to make use of breakout rooms where you have a facilitator in each of those breakout rooms to basically take note of what is being said. Because again, you can't have a good conversation with, as Dr. Golden said, more than 50 people.
Yeah. The other question, which is a related one, Dr. Hendricks raised, if you have a small division where you've only got 1 or 2, you know, faculty of color and don't want to single them out, you know, how do you do that? It might make sense to partner with another department or division, and that might make sense. And if you have a really small department like that, you might actually ask that person, would it be helpful? Because it may not be as helpful for them to have that. And that really, then the focus would be more on the faculty and individuals in that department beginning to educate themselves more. And then we'll be having resources to share on that too.
Right. So I'm going to ask the next few questions in the chat box, then I'll move to the Q&A because we have 8 questions over there. So I see a question from Roy Ziegelstein. So to Dr. Golden, fantastic presentation. Thank you. I've been asked a question by a number of students, trainees, and faculty. It goes something like this. Given the understandable focus on the Hopkins Police Department, is it possible to support campus police while simultaneously supporting Black Lives Matter? And if so, how, when many feel so passionately about the police department topic?
That is a loaded question that I'm not sure I have the right answer. You know, I have to say this is like a very difficult topic to navigate. You know, even for me personally and professionally, because I'm the mother of a 20-year-old Black male child, and every time he leaves the house, honestly, I'm petrified. But separate from that, I've also been a physician in a room with a patient who is not very happy with, you know, maybe how things are going, where I have felt uncomfortable and thought, is there anybody between me and the door in case I have to run out of here? So there's that different safety issue. And that is mixed with the fact that some of our medical and graduate students live in the neighborhoods right around the Hopkins campuses, and they have been profiled by our current security just going to the gym. This is a very difficult and mixed topic that I think we're going to have to figure out, honestly, how to navigate, because I think the key is that, you know, Black Lives Matter need to matter in all arenas. Policing is just one aspect. It needs to be in housing, jobs, income, all of these areas. Policing is one of those areas. So I do think that policing in general will need to be reimagined in some way, and that, you know, just trying to get a handle and understanding on why it is that policing seems to have taken the turn that it has. Because I think until that bigger issue is addressed, this is still going to be a tension. So where that probably doesn't fully answer your question, but you know, it's a challenging topic to think about, you know, the student perspective, and then this perspective of, you know, sort of the healthcare providers needing protection too. So very tricky.
Thank you, Dr. Golden. So Nikki Motters echoed the point about the ICU. They have a very similar challenge of trying to get people together, because in labor and delivery, it's very fast paced and emergencies are happening frequently. Another question, Lynn Farrow asked about how can she get her team into a training cohort. I did just paste in the chat box for additional information about the Unconscious Bias and Diversity Awareness Facilitator Program. Please visit the link that I pasted there. And then now I'm going to turn right now to the questions in the Q&A box. And okay, if the link isn't working, I'll check that in a second. Thank you. So Graham Mooney had a question. Do you have plans to involve students in developing the anti-racist curriculum?
Yes, so the answer is yes. So we are in the process right now of forming a learner diversity council for the School of Medicine. So we have a very active house staff diversity council, and we also have DPAC, which is our diversity postdoctoral alliance committee. We have not had a diversity council that's specifically focused on our medical and graduate students. So, so that will be launching this summer. That council will have representatives from all of the sort of diversity-focused student groups across the School of Medicine, and we will engage them in that process because the House Staff Diversity Council is already involved.
Great, thank you. And let's see. Oh, this question was, will there be an opportunity for leadership groups to discuss the books that you mentioned and talk about where we see opportunities to move towards anti-racist policies and practices?
Yes, so that's a great question. And so those were all of the things like in our wildest dreams that we were planning for FY21. So I think the answer is yes. You know, the value of the pandemic now is that like we all are like, hey, let's just get together on a Zoom, and you can do that pretty quickly. So I know Sharia and I have talked at various points about, you know, maybe perhaps hosting some book clubs around white fragility. I know like the central HR team, some of their central team is going to be doing a book club on So You Want to Talk About Race. So so that's an excellent suggestion that we can, Sharia and I can connect offline about operationalizing that. Because I think it is helpful to like read the literature, but then also then say, okay, now let's look at our own policies and practices and, and see how we can address this.
Right. Great. So now it looks like there is a question from Gail Dommett. And the question is, if you are a supervisor of a research team, would you recommend a listening session or just a more general open discussion with the team staff? What if there are no minorities on your team? What would you suggest?
So then another excellent question. So, it may still be, a listening session or a more open discussion, because even if no one else on the team is minority, chances are, because of the environment that we sit in, that there are research subjects who are, and so a lot of times our biases or approaches or thinking about or our thinking on things can also impact the research populations that we're interacting with. So there would still be some value to that.
Also, Dr. Golden, one thing I was going to add is, although there may be no visible minorities on the team, we don't know. People could be married interracially. They could live in a very diverse neighborhood. They may have family members, you name it, and they could share what their experiences have been with the 4 levels of racism that you talked about.
Yeah, that's a very good point. Very good.
And let's see. Okay, so our next question, this is from, so the question is from Stephen Gould, and I'm sure many other people are asking the same thing, that the slide deck was very helpful. When and how will it be available?
Yeah,
that will be on our website.
On our website, yeah, we'll upload this on our website with the video.
Great. And then Geraldine Seydoux, thank you for your wonderful insights. How should one respond to non-Black minorities who want to share or contrast their experience, or folks who want to expand the discussion to other oppressed groups?
Yeah, so this is a good question, and certainly, in the School of Medicine, we have a lot of non-Black minorities, as well. I think if you're going to expand that discussion right now, because remember, it's about the hurt in the Black community. I think in expanding that discussion, it's avoiding saying, I understand how you feel, because I don't think any of us, I don't understand, I can't honestly say that I understand the perspective of someone who's an immigrant or someone, so I think if you're going to expand that discussion, is to say this has been my experience, but not to try to equate that with someone else's experience, if that makes sense, because I think that's where those discussions can maybe be misunderstood. So that's how I would approach that.
Great. You had another person, I'm not sure who this person is. It's Jed is A Shankar 1, just saying thank you. It's enhanced the information and the graphics are very helpful. So now from Julie Riddler, the person was just asking, if their department isn't holding listening sessions, how can they request us to host one? So meaning our office, I believe.
Yeah, so that could be done through, on the information on our landing page under the racial dialogue resources is that a request can be made that way.
Great, thank you. Our next question is from Lindsay Rothstein. Thank you so much for this helpful webinar. Do you have any recommendations for how entities or departments can create a safe space? 1, over Zoom, and 2, following so closely on the heels of reductions in force, furloughs, and reduced hours when there is increased fear?
Yeah, so that's a very good question. So I think what you're alluding to there is people being nervous about sharing experiences or something, because they don't want that to then be linked to I might get riffed or laid off. So I think so I would not record the session. First of all, you don't want Zoom. Make sure you're using password protected modality, like that's just sort of good Zoom etiquette now. Because it's not mandatory, then people can decide whether or not they want to come and how comfortably they feel. One of the things I should make you aware of is that the Hopkins Diaspora Employee Resource Group, which represents African American staff and employees, has sent out a survey to African American employees, so that we have that additional way that we're collecting information as well. So for people that maybe don't feel comfortable sharing in a listening session, they can still get their perspective heard.
Great. We also have a question from L. Smith 103 asking about what about anti-racism training for bystanders? Any opportunities? So, Dr. Golden, this sounds similar to sort of our allyship training that we were talking about, perhaps.
Yes, so we've been working closely with Dr. Jessica Beanstalk, who is the Associate Dean for Graduate Medical Education, and there will be, she and a few others have done an allyship training in collaboration with the University of Virginia that we're involved with, and so that is going to be a part of the FY21 objectives that we'll be working with her on. And that's a very important point is, just how to empower people to stand up and, and say that they're recognizing that something was inappropriate. Sometimes it can be as simple as saying ouch and frowning, and that causes everybody to stop. But yeah, we will be moving forward with that.
Great. And then our last question is from M. Mendez. Do you have any guiding questions to facilitate a listening session? And Dr. Golden, I'm thinking of what's on our website now. That was the sample templates about facilitating a town hall session, which is a larger version of a listening session. So in those resources that are in the chat box that were placed earlier, I'll place them again. There is a link on our website right now under racial discussion resources, and the resource is called Open Forum for Racial Discussion Template. So it talks about best practices. There's a template for an email announcement that you can tweak for your own purposes, what kinds of introductory remarks, panel member remarks, how to note take and chart, and then what's next as well as follow-up. So that's on the website as well. Hi, Dr. Golden. So thank you for an excellent presentation. Someone did add another resource, a suggested resource in the chat box. I just wanted to read this. Thank you, Lori Jackson. Lori said she wanted to add The Color of Law, A Forgotten History of How Our Government Segregated America by Richard Rothstein as a book to read to educate ourselves on structural racism that has taken place in America and its impact on housing and education, social determinants of health. And so she says, thank you.
Great. Yeah, so that's an excellent suggestion. That's another great book.
Great, thank you. So we do have several questions. So Kenny Golder asks, if no one speaks up at the listening session or town hall, how do you encourage them to speak?
Yeah, so that is a good question. So this is where some pre-work, might be helpful for getting a sense. So this is where the smaller groups are helpful as well. I think part of it is creating that safe space. So one of the things that we talked about, I know at the Johns Hopkins Hospital Management Committee meeting last week was, is there a part of the session, you could do the session in a couple of ways. If part of the session, you as a manager are there, but then there's a second part of that session where the manager is not present so that people feel more comfortable sharing, that's another option to consider, and we have recommended that. So that would be one way that I would address that is having someone who's really not the direct supervisor, and there are for some of the larger group listening sessions, we have a staff member from our office who who is there just to listen, not to guide the discussion, but just to listen and provide support. And so in that particular case, then once a manager leaves, then someone could be there just to see if there are other things that people didn't necessarily feel comfortable talking about.
Great, thank you, Dr. Golden. And a follow-up question to that would be, how do you de-escalate anything that gets heated?
Right, so I think the important thing is when that happens is to pause, because often when that happens, it's because, and this is where the avoiding getting defensive is important, is, it may be that one side says, well, you did X. And so the way to reframe that is to say, as a facilitator, what I'm hearing is that this person is saying that these particular actions made them feel this particular way. So I think it's sort of like reframing it, because often when people get defensive is because they feel attacked like you did. But I've often found that if you say, or it's reframed to say, well, when that action happened, how did it make you feel? And then that person says, I felt this particular way, that people hear that better in many ways. So I think that's an important de-escalation technique, is to make sure that people are feeling heard, and to say, okay, well, let me hear, how did this make you feel? Okay, you said this, what was your intent in what you said? Because what somebody's intent may have been is not the impact, is not how that person is hearing it. So those are some suggestions that I would suggest. I don't know, Cherie, if you have any others before you have to go to your next.
No, I'll stay on for another couple of minutes, but yeah, no, I didn't have anything else. I think you covered it well. This next one, this is Marcial Padilla Jr. The question is, how can you volunteer to get a train the trainer class to do this presentation? And I think the person might have perhaps misunderstood. The train the trainer actually is regarding the unconscious bias facilitator program. These sessions that we're doing are to equip people to actually conduct these listening sessions themselves.
Right. And if you want to share with others on your team, you know, we're going to have this video available on our website. And I think I saw a question about sending or sharing the slides. And, you know, we can put the slides on our website as well, so that you will have them.
Great. Thank you. Let's see. This is a question of, do we know what plans leadership has for a zero tolerance policy in regards to patients who are found to be abusive? And Dr. Golden, I'm thinking of our new policy that went into effect March 1st. This is the prohibiting discrimination by patients against employees. Perhaps that might cover that.
Yeah, so we have a policy on this, as Sri just mentioned, and that policy went live March 1st. So basically, we will not, we will not acquiesce to patients who request that they want to have their, they don't want to be cared for by a doctor who is Muslim, Black, Asian. I mean, we heard all these awful abuses that our staff were enduring. And so we do have a policy now where if in fact a patient really feels that strongly that they don't want to, and we also in that policy have examples of how another staff member hearing one of their colleagues experience this can support them and be an ally. But if the patient really is insistent on behaving that way, we can offer them a transfer to another hospital. So the reason that a lot of our information about that policy didn't get disseminated as widely as we had planned is because COVID-19 hit literally like 2 weeks after the policy went live. And so it may be time for us to revisit, but that's on our website as well, including the recording of the webinars we did on that.
Great. Thank you, Dr. Golden. So we have another question, Joshua Modell. In addition to bias training sessions, is your office working on structural racism / anti-racism, especially in STEM training sessions? If not, any good resources?
So we are going to be working on, the anti-racism curriculum, like in the School of Medicine. I think I wasn't clear whether the question was, are we doing that here? Are we thinking of it outside of here? But the focus will be sort of internally, and it will include our trainees.
Great, thank you. So you have several people who thanked you for the presentation. Let's see, Charles, thanks, Sharita, excellent. His kids educated him about microaggression. He's asking if you could discuss further, and the person thinks it's real and important.
Right. So Charlie, thank you for your question. I remember when his kids were young, so it's interesting that they're now educating him. So yeah, my son is an African American Studies major, and so he's been doing a lot of he's journalism and African American Studies. So I've been educated a lot too, as you can imagine. But so yeah, with microaggressions, this is really important, and I actually think microaggressions are almost more damaging than someone coming right out to your face and saying one nasty comment, because it's subtle and people try to justify the reasons that it happened. So I'll give you a prime example. I was talking to a colleague yesterday, and it was in relation to a national committee I serve on, and I said, every time I would bring up a comment that was different than what the majority of people thought, then I would get a comment back about, I've been involved in this group for over 30 years. And so therefore, because of the year I was born and the fact that I've not been involved for 30 years, then you've just negated everything I just said or everything I'm about to say. And so what happens is if you've had that kind of thing happen to you 5 or 10 times throughout the day, then it's like all these mosquito bites and they add up. And so I think what we're seeing across our organization, I mean, I've been at Hopkins for 26 years now. I've never seen people so upset by current events. And I think it's because all the microaggressions have built up and people really need to be able to express that. So I think, in our unconscious bias training, and we actually have other sessions that are focused a bit more on microaggressions and how to break those down. Like, if somebody says something like, and this is a very common thing to be said to Black people, and I'm sure, and people mean well, they say, you speak so well. And what people hear though is, well, because I'm really surprised, because typically, I expect something less than that. That's sort of how it gets heard. So that's, again, it's the intention versus impact. So that's why we have to really be aware of our words. And if someone says to you, I don't understand what you mean by that, don't get defensive and say, well, I wasn't trying to be racist. Like, they aren't accusing you of being racist. They're just saying that the intent of that message, I hear it, but the way I'm feeling it is in a different way. So that's sort of an example of microaggressions.
Great. And then Tamala, I'm going to turn the questions over to you. And we actually do have a few comments in the chat box. Before I drop off, I just wanted to let people know I did again provide the link to our office's website. In addition to that, if you go on our website, we have resources about facilitating racial discussions. And then Aaron had a question. We also have a resource on Open Forum for racial discussion template. So that's all I had to add right now. So thank you, everyone.
Yeah, but I thank you, Cherie. And I think I will also add that I think John Crockett had asked a question. The policy does address male versus female providers. So it's any protected class, it's race, ethnicity, sex, sexual orientation, gender identity, religion. So it's really any protected class.
Okay. Hi, this is Tamla. There's one that says, does Johns Hopkins have a formal statement about our commitment to anti-racism, or their plans to develop one?
Yeah, so that's a very good question. So yesterday I was reviewing and did some revisions and updates to the, apparently there is a workforce diversity statement, and I just updated and added language in there. And that's going to be like a corporate policy for Johns Hopkins Health System Corporation. And Johns Hopkins Hospital. And then I am going to inquire whether there's an analogous statement on the School of Medicine side, and then work to unify that. So I think that'll be very, very important. So yes, that's being worked on. And, and I think that, part of the reason that they wanted to even revise the workforce diversity statement is really to address the current situation more directly. So we've added some more specific language in there.
Okay, we have a question from Joshua Modell. I've heard from some that these town hall sessions are best done with professional mediators. Can you comment on that versus faculty leading?
Yeah, so remember now we're what we're really trying to do now is do listening sessions, and I think that we have had a couple of our teams try to get external facilitator to do these, and I know of at least 2 situations where that did not go very well. So even though people are professional facilitators, everybody is not necessarily fully equipped around this particular area, and so might actually cause more harm than good than if our faculty and our staff are just ready to sit and listen. Because often what they'll want to do is they want to facilitate, and part of what we're trying to do right now is listen and hear, so that we can really use that information to inform an action plan, which is very different than now. If you have a conflict between 2 people or 2 groups of people in your department or work area, then let us know about that, because that's going to be a very different kind of dialogue. That gets into that restorative justice type of concept that I shared with you earlier. And that's what we're going to get trained to be able to do over the next few weeks.
Okay, we have one from Tamisha Bell. Should this conversation be initiated by African American managers, or should we call on our upper non-African American leadership to stand with us while we initiate the dialogue?
That's an excellent question. I think it would be beneficial for you to have, an upper level manager and ally with you, because a lot of what you're experiencing is your own lived experience, and so it's helpful to you're listening as a manager so that you can support your own employees, but then it's important for your own manager to also be able to hear and understand that. So I think that would be an excellent idea to partner in that way.
Okay, we have one from an anonymous attendee. Says, thank you for this very helpful information. Does JH have resources for recruiting diverse candidates?
So we do. We have that on our website. I believe they're under our resources tab. There are guidelines on to really sort of help expand candidate pools. What are the types of organizations where positions should be advertised in terms of recruiting. So we do have that that resource information.
Okay. Give me 1 second. Sorry. Next question. When it comes to educating, is it safe to encourage managers not to say, help me understand, to employees, rather than the manager to do their own research and talk from that perspective?
So yes, I would really discourage you from saying, help me understand, because a lot of people, what I've heard a lot is, so, the first week, I have to say I was doing a lot of listening because it was important for me and the team in our office to know what it is people wanted. And so people pretty much said, I don't feel like explaining this to people. I didn't create racism and don't feel like I have to explain it. Like that kept coming up repetitively. So I think that, doing your own research and then saying, okay, based on reading X book, like a couple of my colleagues in executive leadership read White Fragility. And then we came back and we were able to have discussion based on the fact that they had already done some digging in themselves. It was a much different kind of conversation, because they're like, well, now I'm understanding this and how that might manifest as that. So yeah, I would definitely have them do their own research first.
Okay. Someone asked, I can't see it's just their JED, but it says, there are many white people who do not believe in white privilege. How do you handle this?
So of course, part of it is there's a privilege of being able to not believe there's privilege because, if you have it, you don't think you have it. So here's the reality to help people think about privilege so the majority of us here at Johns Hopkins have privilege just by the fact that we're educated, right? And so as everybody has privilege in some dimension. White privilege is one form of privilege. There is educational privilege, there's religious privilege, there's gender privilege, there's sexual orientation privilege, there's socioeconomic privilege. So there's privileges in other areas. The fact that, I am an African American who's been to college gives me a privilege that African Americans who've not been to college don't have. And, and so just the fact that I've been to college gives me access to certain things that those who have not would not have. And for me to deny that is not realistic, because it's like I'm wiping out their experience. And I have the privilege of thinking, well, education shouldn't matter, but we know it does. So that you have to think about it. White privilege is one form of privilege because that is the framework and reference group on which our whole country was built. But there's multiple dimensions of privilege. So, so there's privilege in all areas, and white privilege is one. So education is another. So I think it's sort of framing it for people, and the fact that if you don't believe it exists, it's a privilege to not actually think it exists, if that makes any sense.
Okay, I have another one from an anonymous attendee. This is uncomfortable to ask, and my team is appreciative that we have started having uncomfortable conversations just as friends. but I find it a challenge to ensure that when we speak to our teams, that race is not just white and Black. We have an extremely diverse team, and I feel that it's just as important for all races to feel comfortable, as well as acknowledge that many races have been affected at different times. I guess my question is, are we to only focus on the Black race, or how do we incorporate the conversation for everyone to feel that their race is important without downplaying this sensitive topic and all that has been happening?
Right, that's an excellent question. And that one actually came up on our webinar yesterday as well. And so, the way that I would recommend handling that is, so we definitely don't want to ignore the fact that there are definitely other groups that have been impacted, even though a lot of this is about what's happening for Black America right now, that there are other groups. And in fact, I think what has been so heartening for me in all of this, my parents lived through the civil rights movement in the 50s and 60s. And what they said is so remarkably different this time is how multicultural the support is. Which was very different than it was, back then. And so we definitely want that. I think what you can do is, when you're having that dialogue, is just to allow people to say what their experience is. They may have the experience of being an immigrant to America. And I think the key is to not say, well, I understand how you feel because I'm an immigrant, but just to say, this is my experience and these are the things I experienced as an immigrant, and just not equating the circumstances, because the Black experience is different than the immigrant experience, and those are two different experiences, and they should definitely be talked about. I think where people maybe begin to feel like their experience is being wiped out is when people say things like, well, it's just not Black Americans who discriminate against, it's everybody. And what we really should say is, yes, Black Americans are discriminated against, they are, and these groups are, and these groups are. And so it's not like everybody's being lumped together, but, that there is a different, that there is a different experience. I think the key is it's okay to talk about those issues, because there will be some overlap, but it's to not so much say, like, not to equate them as being similar, if that makes sense, but to allow them to still be distinct experiences that may sometimes result in some of the same outcomes. So I hope that was helpful in thinking about that.
Okay, I have one from Stacy Marks that says, once you have the listening session, at the end of the session, do you need to say, this is what we're going to do next, or do you frame it as a thank you for sharing?
So what we would recommend is, thank you for sharing. There should be someone that sort of scribes just some general concepts and tell them, because this is what we would like you to do, is that you're going to be sending, a summary of, of sort of like some, because they'll likely give you some suggested recommendations, for example. And so you're going to send a summary of some of their suggestions or concerns to the Office of Diversity and Inclusion and Health Equity, because we want to be able to incorporate that into our strategic planning. So we already, for example, have strategic action items around, human resources, education, all the areas of our overall strategic plan. But we want to make sure that there aren't areas that we have missed or things that we haven't considered. And that's what the listening sessions are for. So this is going to really help to inform the organizational strategy. So there will be a follow-up and action plan. And then, but if there are some things in your own particular group, like low-hanging fruit things that, out of that session, you all feel on your team, like we could implement this, and this is going to, create, a more inclusive environment. There's no reason that you can't do those things.
Okay. There's an anonymous question that says, any tips for someone participating in a session where they will likely be the only minority present?
Yes, and so, so this came up yesterday also. And so I think it's really important to make sure that that person feels comfortable doing that. They may or may not feel comfortable being the only minority in that session. The other thing to consider is if there's another department that you might be able to partner with, where there would be others in that audience for minorities, so the person doesn't feel so so isolated. If you have no minorities in your department, you can still have a session just to sort of get a sense of from your own team. Are there any issues or concerns or biases or things that we may have noticed? Because it's, we're finding that we have a lot of allies who are white and of other races and ethnicities, and they have been noticing things, and we've been hearing from them as well. So, but specifically to the point around if they're the only minority, I would make sure that person feels comfortable before you would send out an email saying we're going to have a listening session, because if they don't feel comfortable, it may not be the best move. So we're not saying that everyone has to have a session. You have to get the pulse of what your particular area wants.
Okay. I'm sorry, I was scrolling through the questions.
Okay.
Cassandra Herbert asked, would you recommend in the listening session with staff to share the slides and then open it up for staff to discuss their feelings?
That would be a reasonable approach as well. That would be a reasonable approach as well, particularly the information on, like, for example, if you were sharing the allyship, you could, sort of see if people have suggestions on how in a particular area allyship would look different.
Okay, we have one from Steve Snellgrove. Over the long term, what type of structural changes should be considered?
So Steve, that's an excellent question. So I really think about this in several areas, and without sort of, I'm going to talk generally about strategies that we know have worked. And so I think that, the way that we do recruitment can be more transparent. And so, for example, particularly into like senior leadership roles, the managerial roles, that there needs to be transparency and, broad posting of positions. Often, there'll be an announcement about a position, or someone suddenly has a position and nobody ever saw a requisition, nobody knew anything about it. So even if they had the skill set, there really wasn't the opportunity for them to apply. I mean, I can tell you in my many years on the faculty here, I would see somebody announce for a position, and there'd be, a group of us who were like women or underrepresented, and we'd be like, well, we could have done that job, but we didn't even know that job was an option because we never saw it posted. So I think that's important. I think also, we need to consider, in all other organizations, they have tied, diversity and inclusion metrics to a part of, of leadership's, annual review, those kind of things. So there are a lot of structural things we can do. We need to re-examine all of our policies, and re-examining all of our policies, make sure that, our policies don't inherently have language in there that, really disproportionately will disadvantage one particular group. And Inez Stewart and I have talked about that a lot, and she's very supportive of that. So those are some of the structural things. And then, I think that we need to make sure the experience inside of Johns Hopkins Medicine, the culture and environment is welcoming to our diversity of thoughts and opinions, so that we need to be able to listen better. And when new ideas are brought up or old ideas are challenged, that we have to really be cognizant of not shutting people down and not allowing those things to be heard. So, those are some of the structural things. I don't know if that begins to answer the question, but those are the kinds of strategies and things that, that we'll be focusing on moving forward.
Okay, so
I will say that we've spent a lot of time in the last, so today, July 1st, marks my 1-year anniversary in this role. So we spent a lot of time really, writing a unified Johns Hopkins Medicine diversity, inclusion, and health equity plan that is mapped to the Johns Hopkins Medicine overall strategic plan. And so this is the first time that, that's being done. And I think that's going to be really helpful in giving us a guide and a roadmap, if you will.
Okay, there's one that asks, could we partner with language of caring facilitators to make this topic one of the sessions and provide conversation starters for staff?
That is an excellent idea. If you could send me and Cherie an email after this session, and I think because I think this is sort of overlaps that area, because part of the language of caring is like we've got to care for each other, just like we care for our patients. And so I'd be happy to discuss that as a collaboration.
Okay, another one, and I'm just going to summarize what they're asking, is that can they say, as part of the session, their listening session, that the feedback would be sent to our office? Is that the directive we're giving?
Yes, it's appropriate to say that, because what we don't want people to think is we're just listening to be heard and then we're not going to do anything with the information. So the other thing we heard from people initially, we thought we would sort of have some organization-wide town halls, and then what we heard from people is we don't want another town hall where we just sit there and say what we're going to say and then there's no action. So they still wanted to be heard, but what we want to do is take that information and then now use that to help inform action-oriented town hall series that that we hope to start in the late summer or early fall, so that we would be saying, this is what we've heard from you and these are the things that we're now putting in place, and then people can give some additional feedback, so that it's not so much people just saying what they're going to say and then people feel like we've checked the box and heard people and move on. But we're trying to link the listening to action, but I think it's important to be able to reach stakeholders and make sure that they feel like they've been heard.
Okay, I have one from Linda Stewart. Often at sessions like these, we end up preaching to the choir. How do we invite those who really need to be part of this conversation?
So I think that, that those are some of the things that we put into our metrics, and that gets back to, I think, Steve Snellgrove's question about, structure. So I think, for example, with the unconscious bias training, like that will be required. And as we think about anti-racism curriculum and training, that those metrics, have to be required metrics, particularly for those in leadership and others, because those are the groups that are really going to influence, who gets advanced, who gets hired, how our policies are written. So we have to require that. Like, I always joke that I have to do a sleep deprivation module every year as a physician, and I'm always sleep deprived when I do it, but it's required every year. So this should be no different. So I think that's going to be one way of reaching the audience.
Okay, someone is asking, it's an anonymous person asking, does Johns Hopkins support the hashtag Black Lives Mattered, in the assumption that it's being tiptoed around?
Yeah, so so there have been, there was a White Coat for Black Lives rally, and and Kevin Sowers and I have spoken about this quite a bit, as you can imagine, over the last month, and we've determined like Black Lives Matters is not an exclusive message. So in other words, a lot of people said, if you say Black Lives Matter, then that means that other lives don't matter. And that's not the interpretation of that message. And so, we do want people to be able to express, we want people to be able to express, their perspectives, but the messages have to be inclusive. And so, it's not saying that other lives don't matter. And I think I explained to you earlier, historically, why it is that Black lives have not mattered. And this sort of dates back from slavery. And there were just a lot of things put in place to justify slavery and this sort of inferiority. So then today it makes people feel that they can sort of treat certain races and groups of people the same way. And I think some of that also is a concern for other groups in the country. And so we may see other groups over time, sort of evolve, similar sayings. So, that's sort of been our, our perspective on that. If if people, so anyway, that's, and the other thing I'll mention is that we are, establishing a small committee that has representation from our office, HR, marketing and communications, and organizational equity, so that we can sort of begin to consider, as certain sayings and things come up, which ones are consistent with our values, which ones are not, because we do think we need to have a way and an approach to to evaluate those things. So we've had a brief discussion about Black Lives Matter, but as other things come up, then we want to be able to review that in a systematic way. So Neil Dukes, who's the new head of organizational equity for Johns Hopkins Health System and the practice group leader, he and I will be working on that. So just Larice Royal just retired, but you'll see an announcement about him soon, but that's something that we'll be working on.
Okay, so we only have a couple of minutes, so I'm just going to ask another short question. And this one is asking, if you're wanting to check on your colleagues due to current events, what are some suggestions of how to organically do this in the course of a usual work and function in a busy clinical office space?
Yeah, that's a good question. So, so you could shoot, I'm telling you some of the things that my colleagues have done for me that have been so appreciated. You could shoot an email, you could send them a text thinking of you with like your, memoji, just when there is a break, say, hey, just how you doing today? Just want you to know I'm thinking of you. And, it's really simple things. It's very simple things that I know I have personally found to be very supportive. So it can be done in a busy day. It doesn't require a lot of like pre-scripting, if you will. So those are some things I would suggest.
Okay, do you want to take one more?
Sure.
Quick one. It said, if leadership in your office lacks diversity, how is that group going to speak on this subject and be received as genuine?
Leadership in which office? Is this?
I guess in any office.
In the office that you're in.
In the office, that's all, yes.
Yeah. So, the reality is that we don't have enough diversity in leadership. And so part of that, that's part of the role of, in hearing. And so that's where the situation where you may hear tough things about people feeling like they didn't have an opportunity for promotion or to apply for a job. And so then it's like, okay, now how can I, even in my particular environment, when I'm screening applications, is there something that I as a manager can do to correct that, or to speak to those above me who can begin to correct that? Because I do, and this is where you may hear where if you all were really genuine, you would have hired so-and-so. Don't be defensive about it. Just, even though that's hard to hear, take that in and reflect on it and think about how to apply that to the next position.
Okay. It's 11:30.
All right. Well, thank you all. This has been a really excellent discussion. Thank you all for all that you're doing. I realize this is not an easy time and, and not easy topics, but, I think it's, this is a time where, listening is important, and just, making an effort, will be appreciated. If you feel like you're not getting, that people really don't want to talk and don't want to have a session, that's okay too. So it's really important to get the pulse of your employees.
So our first question is, what if your staff ask why now? These things were already happening.
Yeah, so that's a valid question. So one of the things I want to emphasize is that I think it's important to ask your staff if they feel like a listening session would be valuable to them. So part of the reason we're having these sessions is that if your staff want to have a listening session, we want to make sure you have guidelines to do that with, with sensitivity. Some people don't want to talk about it. So part of the why now, though, from my perspective and from the perspective of the Office of Diversity, Inclusion, and Health Equity, is that we are very interested in making sure that our Johns Hopkins Medicine Diversity and Inclusion Strategic Action Plan is really addressing the concerns of our employees who are our stakeholders. And so, we've had a plan for the School of Medicine previously. we have not had a specific plan for the health system. And so what I've been working on over the last year is, a plan that really combines the initiatives in the School of Medicine along with the health system, because that's Johns Hopkins Medicine, to make sure that we're all aligned. We know, for example, that some of the areas that had come to my attention throughout the year are, around HR. So opportunities for advancement, for career development. Is there pay equity? Is there transparency in position postings? That's one set of concerns. For faculty on the School of Medicine side, similarly, but somewhat different around promotion and, are the criteria transparent? Are they equally applied? Those kind of things. So we sort of know, like, there's sort of an HR component, there's a career development component of things, there's a whole employee engagement component. For example, do we have policies that are in fact contributing to people not being able to bring their whole selves to work? So, when we had African Dress Day for Black History Month, for example, some people had to be in a clinical uniform, so they were like, well, I'll wear a headband or a scarf. Some people's managers were fine with that, and some people said it violated a policy of ours. And so we actually need to be examining those kind of things. But there may be other things that employees are experiencing that is hard for us to know. And so that's why we want to hear from people. So this isn't listening for the sake of listening, but it's listening to help inform actions and next steps. And so, what we would like is for, if you have a listening session, to send those themes, a summary of those themes, back to our office. We're going to put up a survey on our website, but you could also email it to diversity@jhmi.edu, because we want to use that information to incorporate into our strategic plan.
Great. So Sharon Sellers asked, do you think a book club or a film club that includes anti-racist materials is a good place to start in your department to engage discussion in a non-threatening way?
Yeah, so I think that's actually an excellent way to start. And I know that a couple of colleagues of mine, and one of the chair of the Department of Pharmacology, Dr. Bumpus, they're going to be watching a film. So it'll be the faculty and the trainees and the staff together, and they're going to be watching a film and then discussing it. So I think a book club or a film, there's a lot of good documentaries, some of which we've suggested on our website. That would be an excellent way to start the discussion as well.
Great, thank you. Stacy Collmore asked, would you recommend suggesting that the department support a local initiative together if the listening session goes well?
So yes, so I think that, so one of the things we want to sort of send out this summer is sort of the overview of our sort of Johns Hopkins Medicine strategic plan. And so there may be an initiative within your department that fits into that. And so, that's also a way to build community, as well as enhance relationships, because I think if we think about a lot of what we do at work and in healthcare, whether we're on the clinical side or the administrative side, that a lot of the work we do is very relational. So to the extent that, working on a collaborative effort can help strengthen and build relationships, that'd be very valuable for a department.
Great. Mark Donowitz asked whether the survey that Suzanne mentioned could be made public, not the questions, not the responses. Basically, I think he's looking for an example that his department could use.
Yes, so Suzanne, I'll let you comment, but we would be happy to, to make that survey available. We can figure out where to make it, because I remember Suzanne talked about the survey at the advisory board of the medical faculty meeting last week, and some of them had requested it too. Suzanne, do you want to comment on that?
Oh, sure. Thank you. Happy to. Yes, of course. We're happy to share it, and also share how we programmed the survey and so on. So we had good support from the strategic planning team in terms of deploying it, as well as doing the analysis. So I believe you have a copy of that survey, or if not, I'd be happy to share it so that it can be shared as shared and customized, frankly, as appropriate. You bet.
Yes, if you want to send me an email, I can send you. I think I have a copy of the survey still, and I can certainly make that available.
Great. Our next question is, I have a small team with only one Black employee. What advice can you provide for creating an environment of listening and open discussion without making my employee feel singled out?
Right, so that's a very good question. And so the idea is not to make this awkward or uncomfortable. So I think it would actually be important to, first of all, check and see how that employee is doing and feeling. And as a manager, talking with that employee one-on-one to find out if they think that that would be valuable for them, because it may not be as valuable for them. And I think, you know, and understand, but at the same time, also wanting the rest of your staff perhaps to have their eyes open. I think there's a balance, because we don't want to put that one person on the spot. So I think as a manager, I would have a one-on-one with that staff member and get their feelings about it before moving forward.
Great. Cassie Alleman asked, is there an implicit or unconscious bias training that is available for all staff rather than just leaders or managers? And I didn't know if you want to take that one?
Yeah, Cherie, sure. you can actually,
yes.
Cherie can take that one.
Sure.
And we will be having everybody do it. We're sort of doing it in stages, but Cherie, please.
Right. Yes. So there currently is an unconscious bias training available in My Learning, but it's focused more so on decision making. So like if you're engaged in hiring, so that would be a place to start. But this is actually a newer program that we've implemented. It's typically a 1-hour training. We've done 2-hour sessions elsewhere. And we also actually have launched 2 cohorts now of unconscious bias and diversity awareness facilitators. They should be up and running by the end of the summer. Although they are certified, we are working in a new normal, and so we need to get everyone comfortable using Zoom, because we're very much accustomed to previously conducting these in person. So we need to make sure that everyone technologically feels comfortable being able to use things such as polling, breakout sessions, and managing our new normal. So yes, and as we said, this will be done in stages. It will be eventually be mandatory for all staff, but for FY21, we're starting with managers and above.
But if you want, you know, a specific, you know, like an unconscious bias training session for like your team or your unit, we can certainly do that.
Right, yes. So let's see. Okay, our next question is, since these sessions are voluntary, what will the organization do to ensure that others hear these messages and understand the impact and existence of systemic racism and other levels of racism? Those who need to hear the message the most won't typically volunteer for these listening sessions.
Right, so this is true. So remember, the point is that in the listening sessions, you're trying to get information from the employees who are the stakeholders that our office wants to reach. When we start then incorporating that into our strategic action plan, unconscious bias training, anti-racism curriculum training, then those will be required. So like sort of the follow-up are the components that will be required. So at some point, people will have to listen in a sense, if you will, you know, as they're going through the curriculum, going through the unconscious bias training. So while the listening session cannot be mandatory, there'll be subsequent follow-ups and trainings that will be mandatory. That makes sense. So, you know, we're using the listening sessions primarily to make sure that we're addressing all of the concerns that are being raised.
Great. So a question came up. What about equity for immigrants, non-Black immigrants, Latino, Muslim, Jews? Will these efforts address those category of people as well?
Yeah, so no, that's another excellent question. And so one of the things that, that, you know, I've tried to really be mindful of in our office over the last year for me in the office, this is just past my 1-year anniversary, but is that we are addressing the issues of all groups. And so, and we've really done that throughout the year. Of course, the issues that happened most recently, that came to a head in June, did impact the Black community. But, you know, our unconscious bias training talks about biases in all dimensions. And one of the reasons that we want to, in addition to having an anti-racism curriculum, sort of have what I started thinking of over the weekend as an anti-ism curriculum, is because there are multiple isms, right? And so we want to cover issues of immigration, religious differences, sexual orientation and gender identity differences, ability status differences, ethnic differences. So we will be evolving all of those you know, in our strategic plan. So our strategic plan is not just focused on diversity and inclusion in the African American and Black community within Hopkins, but all of those groups. But right now, because of the issues that happened most recently, that's why this particular focus has been on structural racism.
Great. So our next question is, or it's a comment, I guess. I agree that silence is not a good option, but do you think an old white man, the person who's putting out the comments, has legitimacy to be posing the questions to staff or colleagues that need to be asked?
You know, so it's a good question. So here's the one of the realities is that I do think that it's important for those of us who are African American to not be the only ones who talk about this. And I think that it's really important for some of your staff or trainees, mentees, whoever they are, to see that you have the courage to sort of tread into that space. Like, it would be easy if we could clone ourselves in the Office of Diversity and Inclusion for us to go around and do this for all the departments. But part of what we want to do is to empower you to be able to do that as well. And that's why I think Dr. Hill's approach that he mentioned and saying, you know, look, I recognize that, you know, I don't have all the answers here because I'm one of the people who has benefited. And so, but because I have a particular privilege, I'd also like to be a part of the solution. Because if you think about it, all of us on this call, the majority of us are privileged just by the fact that we have an education, right? So all of us are privileged in some dimension. And so then it's incumbent upon us to use that privilege to advocate for those who can't. So, you know, that's how I think about that.
Great. Let's see. Okay. The next question is, my team contains people of color, but no Black people. When we talked about what's happening, I heard Blacks aren't the only people who experience discrimination, you know, like all lives matter. This person's response was, of course, that's true, but we need to focus on where the bleeding is worst first. Any advice on how to discuss this topic when there are no Black folks present? So we had the one where there was one. Now this one has none.
None, right. So this is another common question. And I think that your answer is very appropriate. And so the reality is right now, you know, Black America is really wounded. You know, I mean, just looking at the statistics from COVID alone, even before, you know, the murder of George Floyd and Breonna Taylor and Ahmaud Arbery, you know, like there are like 25,000, and now it's a bigger number, African Americans who died from COVID. All of them weren't low SES. And, you know, if in fact the death rate in African Americans and whites have been the same, there'd be between 13 and 14,000 more African Americans still alive. I mean, Black America is hurting right now, but that does not mean, though, that there aren't other groups in America that are also hurting. And I think what we have to do is not equate them. So, you know, I think, like, to say, you know, and you all should know from messages that I've sent out around COVID that I've been very concerned about our immigrant community getting the resources and support that they need. And our office has been very much advocating and a part of getting mobile testing set up in our 21224 zip code and really supporting our immigrant community, for example. And so, you know, but just like I don't understand what it's like to be an immigrant to this country, because I'm not, it's hard for somebody who's not Black to understand that experience of structural racism that almost happens from birth. So I think the key is to say yes and. So yes, like there is discrimination against immigrants too, and yes, there is discrimination against these groups. And at the same time, you know, there were a group of people that were brought here to the US 401 years ago against their will. And even after being freed, new laws were created to entrap. And so this is why we have this. So there are some differences. And I think it's okay to say that they're different. So I think your response is appropriate. And I think what we really want people to do is to have empathy. Like, I am completely empathetic for the plight of immigrants to this country. That's why I've worked very hard during COVID to make sure that we get resources for them that maybe if you're undocumented, you don't even have access to during COVID because, you know, you have to be a citizen to get them. So that doesn't stop me from being empathetic, but I wouldn't in any way sort of equate, you know, my experience with that of an immigrant, because they're two different things. So that's how I would handle that.
Great. And Also, too, I'm going to go to a chat box because a couple questions did come in that way.
Okay.
The question was, if we place a sign-up sheet for our staff to voluntarily attend sessions and the audience for one of the sessions is not ethnically mixed, what would you recommend?
I see. So that might be where starting out with a book club or a video clip excerpt, you know, if you want some maybe recommendations about how to, you know, maybe like a reading or something to stimulate conversation, that might be a helpful way to get a dialogue started if it's not an ethnically mixed group. And so we have some video clips and some examples on our website, and we'd be happy to make some suggestions to you, because I think that would be a way to spark that conversation. If it's not an ethnically mixed group.
Right. And Dr. Golden, I wanted to add something too, is one of the current concerns that we keep hearing call after call is, oh my goodness, what if there aren't people of color in the group? One thing we need to recognize is that white people are affected by racism too. So by having these listening sessions, you might actually hear about experiences people have had. They might be interracially married, live in diverse neighborhoods, etc. So putting that burden and onus on just the people of color, or I'll say specifically Black people to speak up, we might be missing a lot by not listening to those other perspectives as well. We have another comment.
Let me just make one more comment about
Mm-hmm.
that, Cherise. Remember that all of us here are typically, or many of us, even if our teams are homogeneous, we are maybe involved, we're involved in patient care. Chances are we're taking care of an ethnically and racially mixed group of patients. So the reason that the D&I issues are so crucial for us here in healthcare is because they impact patient care. And so just that's something else to keep in mind.
Absolutely. Thank you. Wendy Fong had a suggestion. Can we address to the attendees the importance of allyship?
Yes, and thank you for bringing that up. That is so important. So I talked about the steps to non-optical allyship, but I want to talk about what that looks like in real time, because there is a lot that we can do that is very simple. So this is the example of, you are in an environment where you hear someone say something and you know it's inappropriate. So, you know, I'm trying to think, I'll give an example of a microaggression. You know, like somebody might say, you know, I have a friend who is Puerto Rican, but born in the US. And she said when she would come down off the podium after giving a scientific talk, that people would say to her, well, gosh, I'm so glad I could understand you, like you speak English so well. She's like, well, I was born in Miami. Okay, but what if you're the colleague of hers standing there? You can intervene and say, well, I'm sorry, how did you expect her to sound? You know, and so just sort of helping the person who's made this insensitive comment see themselves, you know, say, well, you know, of course I wouldn't expect anything less of her. She is, you know, an endowed professor at so-and-so's university. So like there are ways to be an ally. Another example is you hear a patient make a racist remark or a sexist remark to one of your colleagues, and speaking up and saying, we don't accept that here. And so I think that allyship is important, because if you don't say anything and somebody like is already victimized by the comment that was made to them, when no one says anything, it's almost like a second victimization in a sense. So that allyship is very important. And I know that Cherie and Dr. Jessica Beanstalk, particularly for the house staff and the faculty who help to teach and precept the house staff, will be working on allyship training, because we think this is very important.
Absolutely. Thank you. So we already addressed this question. This was about, will HR identify required unconscious bias training for all? As we mentioned, this is actually a phased process. People can go in and do the trainings that are currently in My Learning. If you do have an individual request for a department or a division, contact our office and we will address that. So thank you. Okay, this next question, Erica Nakajima. In regards to hosting a book club, do you advise having formal facilitators? Should that person have formal training in diversity, bias, or racism?
You know, so, and I'd be interested in Cherie's response to this too, but I'm thinking back to, you know, book clubs that I've attended like over the years where none of us necessarily had experience or expertise in the topic of the book, but really the point of the book club is to generate discussion. And so I don't think it's necessarily to have an experienced facilitator with a background in in diversity and inclusion. If you're reading a book like, Robin DiAngelo's White Fragility or one of those books, what you end up talking about is, the topic of the book. And then as I reflected on that, how did that relate to me? How did that make me feel? And so I think really what the purpose of the book club is for a lot of self-reflection and sharing of that and the things that you found tough about it. I don't think you need an experienced facilitator to do that.
I wholeheartedly agree, Dr. Golden. And actually, depending on which book you're reading, oftentimes there is some sort of a reader's or facilitator's guide that has sometimes questions by chapter, questions to consider that you can send out to people while they are reading the book. So I agree, you definitely don't need someone who's an experienced facilitator in that particular topic. Let's see. Okay, so this question, several Black employees in my department report microaggressions from an executive leader. I've seen it as well. How do we handle microaggressions that aren't easy to prove are happening?
Yes, so that is a tough one. That is where that could come out in listening sessions. I think it's important to document those, and if there is ongoing concern, there can always be, an evaluation. If you have a real concern, there can be an evaluation from organizational equity as a step to consider that. Microaggressions are harder to prove, but they can be more painful because they're like cumulative and they're like these little mosquito bites and they just keep at you and keep at you. And so, that's definitely the kind of behavior that, we want to know about and figure out how to address.
Great. So in the interest of time, I think this will probably be our last question. We have several others in the chat, in the Q&A. But this question is, in the case where listening sessions for our group would not be beneficial, in particular for our Black group members, what are other steps we can make as a group before trainings are available, et cetera? And I was going to say, before you answer this, Dr. Golden, so I think you had mentioned before is when we go into these listening sessions, we have to not be defensive. You may be very uncomfortable with what you hear. And we also don't want to assume that it wouldn't be beneficial for the members. We don't know, depending on who shows up, they might find it beneficial. So I'll turn that question over to you.
Yeah, I think, if people feel like they don't want to have a session right now, I think this is a good time to, for you as the manager or the leader to begin to read and sort of do some self-education and reflection on some of the contributors to structural racism, some of the, understanding what some of those issues are, how they manifest themselves. It's interesting because I have a son who's a rising senior in college, and he's double majoring in journalism and African American studies at Northwestern. And, it's interesting because he went to a private school here in Baltimore where they could teach curriculum. He read things about slavery that I had not read until I was almost an adult. And so I can tell you that for many of you who are my age, and I will decline to say what age that is, that many of us have not heard all of the real African American history and Civil War and civil rights history in great depth as it is. So there's like a lot of learning and education that you can do. In the interim, as we begin to think about how to roll this out to the organization. And we will be rolling out a town hall series later this year that really addresses how structural racism manifests in various areas of our lives. So there'll be more to follow on that.
Great. Thank you, Dr. Golden. And I do want to encourage people again to please visit our website. It's www.hopkinsmedicine.org/diversity. On there, we do have a series of resources on racial discussions and racial justice. And as Dr. Golden mentioned, we have links to books, articles, video clips, you name it. And that might be a great starting point for people to basically become more educated on these topics.
Well, now I'll turn it over to Cherie, who is going to facilitate our Q&A.
Great. Thank you. Good morning, everyone. So our first, actually, it's a comment. This is from George Labdas. He said, "Hi, Dr. Golden. This is George. There was a compelling article in the New York Times Sunday magazine a few weeks ago focusing on our racist history, and made a compelling case for reparations. This might also be worth mentioning to the group as a good read. It definitely helped me think about the issue differently. So I just wanted to draw attention to that article, which I will be putting in the chat box. This is an article by Nicole Hannah-Jones, which, by the way, she's the one who is the creator of the whole New York Times series 1619, which is listed in our list of resources. Highly, highly recommend it. And in addition to that, if that's something you want to explore as a team, they do have facilitation guides available with that. So the article that George referenced, though, is called Ode, with a subtitle of "If True Justice and Equality Are Ever to be Achieved in the United States, the country must finally take seriously what it owes Black Americans." And that was actually published back on June 30th, 2020. So I will post that in the chat box in a couple of minutes.
No, thank you, George, for sharing that. Yeah, and we actually want to add that to our resource list. So
absolutely
grow. So
yes, and also too to other participants, as you hear resources, if you send them to us, we can add those to our website as well. So thank you. So Tony Jackson had a question saying, thanks, this is good. Is this available to all employees? So basically, our intention with this was to offer this to managers and above so that they would facilitate these listening sessions in their areas. A webinar recording and slides will be posted to our website, which has been pasted in the chat box and which Dr. Golden showed at the end of her presentation. And with these slides being available, you can feel free to use certain aspects of these slides to guide the discussion, such as how to be an ally, the levels of racism, and moving through that whole continuum. So yes, feel free to share, please.
Yeah, and the recordings will be available to to all employees, because you can use you'll be able to access it with your JED. So yes.
Excellent, thank you. Okay, we have a question in the chat box from Debbie Miller. Thank you so much for facilitating these sessions. I found this incredibly helpful. Of the several books you recommend reading, which one do you recommend first? My work team wants to start with one to read and have a book club discussion, and then another.
Right. So yeah. So that's an excellent question. There are a lot of excellent books out there. So I probably showed my bias a little bit in the ones that I showed you on the slide. I think just to begin to be able to comfortably have conversations, and I think not just about race, but about any differences. I really like White Fragility as a place to start, and there are some facilitation questions that come with that, and certainly Cherie could make some of those questions available too. Interestingly, I learned about that book from my 20-year-old who is a double major in journalism and African American studies at Northwestern University, and he was taking I think a race theory class at the end of his sophomore year, and he was, it's funny when you start as a parent learning from your children, they start teaching you. He's like, Mom, if you're going to be a chief diversity officer, you need to read this book. But it's a really compelling book, and our whole JHM executive leadership team has read this book. And so it's a good place to start. Another one is So You Want to Talk About Race, which is one that HR's Learning and Organizational Development is going to do a book club on. I think those two, and then there's Ibram Kendi's How to Become Anti-Racist. So I think one of those three is what I would recommend, just about the dialogue process. If you're really interested in a good read about the impact of structural racism, I think the Not in My Neighborhood is an excellent one, because it's very specific to, for those of us who work on the Baltimore campus, it's very specific to what has happened in the Baltimore region that may not be quite as relevant maybe in our NCR and in Florida, but certainly on our Baltimore campuses, that's a really good overview of Baltimore, what's happened in Baltimore City. So
Great.
I hope it's helpful.
Excellent. And then Monique Jindal also chimed in. So she said that because she actually already teaches an anti-racist curriculum to residents, she said that she recommends White Fragility first, and then How to Be, as you said, Anti-Racist by Ibram Kendi. And then another good one is Why Are All the Black Kids Sitting Together in the Cafeteria by Beverly Tatum. So thank you for sharing that, Monique. We appreciate that. Let's see. Okay, we have from Janelle Wyatt. She had mentioned that at JHCP, Johns Hopkins Community Physicians, the one listening session they've had was for all employees, 1,400 providers and staff, inclusive of all departments. What is the suggested number or recommended number of people attending each listening session?
Yeah, so that's a good question. There's not like a magic number, but I sort of begin to feel like when you get above 100, it's less likely that people will actively participate. So for a very large organization like JHCP, I remember Dr. Kravitz and I, as well as Melissa Hellicky, sort of spoke about how to do that. So if you sort of have like one broad session just to sort of introduce the topic, for an organization as large as JHCP, you could then begin to have follow-up discussions that are broken down like by your sites, because one of the advantages of sort of having teams that work together always do a session is those teams are going to be working together consistently, and so it sort of also helps with team and community building in a sense. And so and even if there's some JHCP sites that are very large, you might break it down by department, but I would say for a large organization, at least breaking it down by sites.
Great. Thank you, Dr. Golden. We had another suggestion come in from Donna Botkiss about Just Mercy by Brian Stevenson, was also a book that she found beneficial in highlighting structural racism. And yes, so these are all books that we've recommended. Some people were also thinking of viewing films or some of the shorter video clips. So there are so many things out there, such as 13th. I mean, there are a lot of other things out there, and those are also listed on our website. So if you go to our website, which is listed, it's pretty easy. It's just www.hopkinsmedicine.org/diversity. Scroll down where it says news and announcements. You'll see a whole section that says racial discussion resources. Click the downward arrow, and we have a whole host of materials listed there. So thank you so much. Let's see. Okay, we have a question. With such a diverse workforce at Hopkins, is there a way to conduct more diversity training on a more regular basis? So let me start with, so we have trained our first 2 cohorts of unconscious bias and diversity awareness facilitators. First group finished in April, second group finished in June. We are in the process of getting everyone up and running, and we hope by the end of the summer, I'll say by September 1st, that at the various entities where people have been trained, that they will be available to do both unconscious bias and diversity awareness trainings. One thing we need to be cognizant of is that with COVID-19, we are not going to be doing in-person trainings anytime soon. So we are just trying to make sure everyone's comfortable facilitating via Zoom, the nuances. There are such things, because I see a number of the questions coming in. We have a really large group. What can we do to facilitate these listening sessions? You can take a larger group and then use breakout rooms, and then have someone in each of those breakout rooms sort of as a scribe, so you can get not recording what people are specifically saying, but high-level themes that you're seeing. So that would be extremely helpful. So we do have those plans, and also too, as Dr. Golden mentioned, we are, for our FY21 system-wide metric, we are planning to do 1-hour unconscious bias trainings for managers and above on the health system side, and then on the School of Medicine side, managers and above, faculty and trainees, so including residents, fellows, our grad and med students. So I hope that.
And one thing I'll mention too is that we would like to incorporate unconscious bias training into like annual staff update. Like, so it's not like we're going to do this year and check off a box. Each year there may be a different focus to the training, but this will be an ongoing part of what we do.
Right. Absolutely. Great. Thank you. Oh, yes. So this was just a question for Suzanne, and I can answer this one. So the survey that Suzanne referenced, yes, we are going to make that available. That will be on our website. I think this was Trish Dash. And yes, we'll be sharing that survey, so you can use that as well to start and continue the conversation. So thank you for that question. Let's see. Okay, so Retzer Kariaga said the listening sessions are best for smaller groups. However, we at the Ambulatory Diversity Council would like to host a session with the council members. I anticipate virtual attendees would be between 15 to 25 members. Do you have any specific strategies for a big group discussion? So I'll turn that to you, Dr. Golden, but I think that the strategies we mentioned here are applicable to whether it's a larger group or a smaller group, but I'll let Dr. Golden take the rest.
I was going to say 15 to 25 to us feels like a perfect size group. Actually feels a little bit on the small side.
Right. Absolutely.
So you should not be concerned that that's too large a group. And, some of the things that you can consider are just like making it a listening session, or you could sort of have people, watch a video in advance and then use that as a foundation for discussion. So, there are a lot of ways to sort of jumpstart, that discussion. And I think one of the things about, sort of how you start the discussion, and this is a question I think Danelkea asked over in I meant to say put all the questions in the Q&A box instead of the chat. That was my fault, so apologies for that. But she raised a question that, if you're having a listening session, that the white participants may be reluctant to be the first to speak because it feels like taking too much privilege, but at the same time don't want to put, pressure on the Black participants to feel like they have to speak if they don't want to. And so, Peter Hill couldn't join us today because he's on vacation, but he joined Suzanne and Cherie and I for a session earlier this week. And, what he started out saying to his teams, and he's done, I think, 3 sessions, is that, I need to start out by acknowledging that, I've benefited from white privilege, and white supremacy. And these are things that I have not had to think about. But I acknowledge that for many of you, that this is not how you have had your daily experience. And so, I want to be able to use that privilege in a sense to be able to become a stronger ally. And then he paused. That's how he opened up that discussion. And so, as a leader, I think that it is, it's okay. I think it's an important acknowledgement, because sometimes people don't know where the person starting the dialogue is coming from. So that can also make it reluctant for people to speak up, but just the acknowledgement that, yes, I am in a position of privilege. I recognize that. And, I want to use that privilege to be able to become a stronger ally, to support and advocate is a good way to open that up as well.
Great, thanks, Dr. Golden. And so, yes, several people, Monique mentioned that the Zoom breakout rooms were really great with residents. So yes, thank you. As a follow-up, so when we were talking about the various trainings, so as I had said, for this year, we are starting with our managers and above, and the groups that I mentioned being mandatory. We do anticipate that there will be annual updates with different content each year, but we need time to ramp that up. This will be stuff we'll be able to perhaps put in My Learning, as well as have as live sessions, probably remote, like we're doing now. But yes, that is coming. So,
but it will be the FY21 objective. That will be mandatory.
Yes,
optional.
Yep, absolutely.
Clear.
And yes. So let's see. In addition to this, okay, so here's another suggested resource, Jennifer Glenn, thank you. Another great article is Demarginalizing the Intersection of Race and Sex by Kimberly Crenshaw. Yes, and she's also the person who coined that whole term of intersectionality, that it's all the multiple components of your social groups, especially those who are marginalized. So it's like race and my gender, race and sexual orientation, gender identity, all of those. And then also, yes, the book by James Baldwin, The Fire Next Time. And also, in addition to his book, there was the film that came out a couple of years ago, I Am Not Your Negro. Fantastic film, very, very powerful. So thank you, Jennifer, for sharing that. And I'm just scrolling back up here. Let's see. Okay, so we have a question. And so I think Dr. Golden talked about this a bit when she was discussing her guidelines. I'll go ahead and read it. So this was a person who conducted a listening session with a team in the aftermath of the George Floyd killing. The team consists of 1 Black person, 2 non-Black persons of color, and 3 white people. 1 white male in the team who lives in DC started talking about how unsafe he felt with the protests in DC, how there was graffiti in his neighborhood using negative language towards white people, and how that was so unfair to him as he is really a good person. How would you recommend preventing such sessions from turning into an All Lives Matter while not deterring some of the people who need to learn the most?
Yes, so that is a really excellent question. This is why starting out with a book, White Fragility, is very helpful, because, so that response is actually an example of that in a sense. And so I think that if you're the person facilitating, you have to say, but let's step back and do some perspective taking, that, if there have not been 401 years of structural racism that has been allowed to be perpetuated, then we wouldn't be having the conversation. And no one is saying that he is a bad person. And that feeling, unsafe feeling that he has because there were protests in the neighborhood, that's the unsafe feeling that, many of the others in the room had like on an everyday basis, no matter where they go. So I think trying to use that person's experience in that one isolated incident to say, now, can you imagine feeling like that every day, no matter where you go? So, because I think that, so in some senses, it's not like sort of not acknowledging that that person may feel that way, but the reality is that Black Americans, people of color feel that way, and there can be like no protest going on. They feel that way just walking down the street or walking into a store or whatever it is. So I think that that is one way to, you know, to address that kind of thing. And, you know, if there's not time to read Robin DiAngelo's entire book, you know, there is like about, I think maybe like a 1-hour video. Dr. Jessica Beanstalk shared it with me and Dr. Higgins, but there is a video that just sort of goes over some of these guiding principles that might be helpful before having the listening session. But I don't know if anyone else, if Cherie or Suzanne have, you know, a follow-up response to that, but that's how I would handle that kind of, you know, that kind of scenario, is to say, you know, yep, I'm sure that you feel that way, but some people feel that way every day and there is no one protesting around them. I think that's how.
I agree.
I agree 100%.
Yes. So I wanted to acknowledge, thank you, Charlie Roland, who said, thanks to all of you. I think these sessions are helpful in preparing our leaders to hold listening sessions. And as I think you know, we at Johns Hopkins Hospital are encouraging all of our administrators, directors, and managers to hold these sessions in July and August. Thank you. So thank you, Charlie, for mentioning that. So we did have a person ask, how can we find or bring in trained facilitators to facilitate discussions with our teams? I don't feel sufficiently prepared to run such sessions and don't want to go down the wrong path or say the wrong thing. So I wanted to jump in and answer this first, and I'll turn it over to Dr. Golden. So the purpose of holding these sessions is we want people locally to conduct these sessions. It's much more powerful having your own manager, your own director have a listening session. So basically it's opening up with one question, listening, and that's it, listening. So you don't need to be a trained facilitator. One thing we're encouraging is it does not need to be that Black employee or the Black manager facilitating that discussion, because they're part of the group that has been targeted. So we also want to make sure that you feel more comfortable doing these yourselves, so that you don't need a trained facilitator to do that. So I'll turn that over to Dr. Golden, because also too, when she walked us through the whole continuum of where we're at, recognizing people might not feel comfortable even though you're the manager, but we've got to become comfortable in become comfortable in our discomfort. So you may hear things you have not heard before, as Suzanne acknowledged, and I appreciate you sharing your experience. So it's oftentimes doing work similar to what Suzanne did with her team.
And I also think that, you know, again, so what we're really trying to focus on is the listening part of this. And so, you know, if we are listening, it won't necessarily be as much, like there's listening and dialogue, and I think that the listening is important, and it is okay to be a bit uncomfortable. We will become more comfortable talking about race if we talk about it more and just not talk about, like, I always joke, race is not a 4-letter word. I mean, it does have 4 letters, but it's not a 4-letter word. Like, we need to talk about it like we talk about everything else and not make it so taboo. So I think that that's, you know, very, very important.
Great. So in the interest of time, I'm going to take one last question here. And I apologize, we had so many flooding in, so we won't be able to get to everyone's questions. But one question that came up is that, so what advice would you give to employees if their departments haven't had discussions and they're reluctant to bring it up?
Yeah, so I think part of it is to you know, I mean, so if there are a group of employees who feel like they would benefit from a listening session, you know, is to bring that up with the manager, say, we think that this would be something that, you know, that would be beneficial, you know, for us and our team. And, you know, there are actually, I think someone had asked about facilitator guide or listening questions. On our website, there is a set of guidelines. Jennifer Clark had put together some guidelines from learning and organizational development, and we sort of adapted that to be a little more specific to this situation. But, you know, I think that if you feel like it would be beneficial to, you know, encourage your manager, or if you know of a session that's going on maybe in another department, near yours is, you know, for some smaller departments sort of coming together and doing some joint sessions might be beneficial as well.
Right. And then I'm just looking at the chat box, just wanted to answer some really quick ones. So again, webinar recording and slides will be posted to our website. What Dr. Golden just referred to is on our website under racial discussion resources. To L. Dougherty's points, so these sessions aren't just limited. This was just really an overview for managers to try to get them comfortable conducting these listening sessions, but your listening sessions should be open to anyone in your area. Those should not be just limited to managers and above. So,
everybody in the area. So I would say a lot of times, like we have an email template that says, this is how you would send out the email to notify people that there is going to be a listening session. But just remember that there are some of your frontline staff, like your technicians, your phlebotomists, people who may be out on the units that aren't sitting by the computer. So, in my ideal world, one day, and Suzanne and I've talked about this, we'll have a text to messaging system that let people know things that are going on, but just different things. Make sure that everybody is aware that you use multiple communication modalities to let people know.
Right. So I'm just going to close with responding to two quick things. So a question from Melissa Richardson was, should VPs kick off these discussions or should the director or manager do this to keep it local? So we all recognize that culture is local, and it is much more powerful to have that person who's over that team conduct these listening sessions, because they're probably going to be maybe more familiar with some of the issues, with the items that come up. They might be better positioned to be able to address some of these if possible. So I think it's better to actually have it more locally based rather than the giants, everyone in this area, versus my small unit or my division or my team, that kind of thing. And then lastly, I'm sorry, go ahead, and then I'll share.
Yeah, I was going to say, if the VP wants to attend some of the manager sessions, then that might, be okay. But really, like VP there to, maybe to introduce and observe, and then have the manager do most of that.
Right, so. Absolutely. And just one last resource, we're mindful of time. Thank you everyone who stayed with us. And this goes back to the 13th that I mentioned, that's I believe still available for free via Netflix, was the book, The New Jim Crow. Absolutely. Michelle Alexander, it ties very closely. And then also too, someone mentioned Dear White People on Netflix. It's also great as a less heavy option for a very heavy subject. So thank you. So I'll turn it over to Dr. Golden.
So thank you. We're a few minutes over, but thank you all for joining us. A sunrise presentation this morning. And so we hope that you found this valuable. And as mentioned, we should hopefully have our website updated with the recordings from these sessions and everything by the end of this week. So thank you very much.
Great. Thank you, everyone.
Thank you again, Suzanne, for sharing your experience.
And thank you very much, Dr. Golden.
All right.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.